Hello, welcome people. We know that anti-cancer drugs are so toxic. Everything you know already, or we should go through all this again? You know. Otherwise, you will go back and see the toxicity video, right? So now, all this toxicity, how do we reduce? So for that, we are going to go to this video. Methods to ameliorate or reduce toxicity due to anti-cancer drugs. So overall in this, we will just look at some terms, don't go to much details, okay. What you can give toxicity blockers. Folinic acid where you will give, if there is a folic acid, you're giving a folate antagonist like methotrexate, right? For methotrexate, then you will give folinic acid rescue. For cyclophosphamide, you will give mesna. Right, cyclophosphamide and ifosfamide, you will give mesna. Mesna is a thiol or a, I forgot the word, thiol compound, correct? So basically along with mesna, you can give irrigation of the bladder with acetylcysteine so that you can prevent cystitis, hemorrhagic cystitis of bladder. Guys, if you don't understand one word, that means you have not seen the previous videos, okay? Then coming to cystitis by cyclophosphamide and ifosfamide. So because of these, if you have cystitis, then you will cure that with, you will give mesna and also you will irrigate the bladder with acetylcysteine. If you are giving methotrexate, which is a folate antagonist, then you have to give folinic acid rescue. Methotrexate is a folate antagonist, that's correct. So to handle methotrexate toxicity, give folinic acid. Okay, this is folinic acid here. Look at this, folinic acid. Then ondansetron you will give, ondansetron. If there is vomiting, all of them will cause vomiting. Cisplatin actually is highly emetogenic. Then to avoid to handle cardiotoxicity, you will give dexrazosane. This one, dexrazosane. Okay, chelating agent. Moving on, guys, you should know amifostine. This one is used for the cisplatin toxicity. So if cisplatin induces nephrotoxicity or neurotoxicity, then you can give amifostine, okay. Then coming to alpurinol for reducing the hyperuricemia. This is alpurinol, the tablets shown here. Then you will give biphosphonates to manage hypercalcemia. Shown here are the biphosphonates. Usually, if any cancer patient is there, you would have heard they are going every 2 to 3 weeks, they are going for treatment and all that, right? That's pulse therapy. Why they are doing that? They are giving anti-cancer drugs intermittently so that you are giving recovery time, okay? So, you should give time for recovery, normal cells so that they can recover. You will give pulse therapy, okay? Then you will also, instead of giving everything systemically, you can give them topically or intrapleural, intraperitoneal, intraarterial, targeted kind of treatment. That will also help reduce the toxicity of anti-cancer drugs. Then guys, we are moving on to the fourth slide, isn't it here? So some more toxicity, okay, some more here. So you can infuse a person with platelets, granulocytes. Then you can also give some recombinant agents like filgrastim, gramostim, yes. So you can infuse them with all these. Then bone marrow transplant, if it is required, can be done. But all this sounds like very scary. I don't know if people will even go for a cancer treatment if there are so many things to be done to manage the toxicity. Okay, then thalidomide. Actually, thalidomide also is used to reduce the toxicity of anti-cancer drugs. See this, we are moving on to the next slide here, just explaining thalidomide. Thalidomide actually was banned in 1961 because it had a teratogenic effect called phocomelia, where the babies are born like this, where the limbs are affected. Okay. But now what happened, they found out this thalidomide is very good in managing the toxicity of anti-cancer drugs. So obviously it is given to ameliorate toxicity of anti-cancer drugs. Let's revise what we have seen so far in this video. A lot we have seen. Methods to ameliorate reduce toxicity due to anti-cancer drugs. First of all, you should know the toxicity. Write a brief introduction about toxicity. Then if they have asked you methods to ameliorate toxicity, you can write all these. Mesna, to avoid the cystitis. Folinic acid for methotrexate toxicity. Ondansetron to treat the nausea vomiting. Dexazone, okay, is a chelating agent to lessen cardiotoxicity. Then you have the amifostine to treat the cisplatin toxicity. Then you have alpurinol to reduce hyperuricemia. Then you have biphosphonates to treat hypercalcemia. So cancer therapy is given in as a pulse therapy. So with intervals in the middle, 2 to 3 weeks interval for normal cells to recover. Then you can also give topically intrapleural, intraperitoneal, intraarterial instead of giving it everything systemically. Platelet infusion, granulocyte infusion of biological agents like recombinant, GM, CSF, GCSF, etc. Bone marrow transplant, okay, and then thalidomide. So that's all we have seen in this video. Hope you have enjoyed the entire anti-cancer drugs videos. More will be added if we think that specific drugs need attention. Okay. See you for now, guys. Bye bye.